Welcome everybody to our bi-monthly appointment Q&A with Barbara, where you send your questions and I answer them for free every other Thursday. So let's just dive right in. The first question comes from Nicole Melnick. Let's see what she's asking. Dear Barbara, I'm wondering how to choose the best supplements when healing ADHD for a 10-year-old. I see the list, but it is in alphabetical order, so I don't know which supplements are a must. We're currently doing the basics: B12, zinc, ester C, Neuromag, and lemon balm. We also do celery juice, off the no foods, eating tons of smoothie during the day, eating meat for supper, working on heavy metal detox smoothie, although it doesn't like the taste yet. Would I see a bigger change if I remove the meat from his diet? He's very impulsive and likes high-risk activities. We're trying to tame those behaviors. He has been doing medical medium whey for a year now, with no improvement in behavior yet. Thanks so much, Nicole. Congratulations on having your child on a medical medium protocol for over a year. This is amazing. The other good news is that your child is only 10, so we still have up until 18 years old to remove a big amount of toxins from the brain, because as you know, ADHD, much like autism, it's neurotoxins in the brain. So at 18, it's really when the midline canal between the left and right cerebral hemisphere of the brain closes. So at that point, it will be harder to remove the toxins. Possible, but a little bit harder. Right now, it's really the time to really work hard to remove all these toxins. So my suggestion to you is to do it primarily with food. And of course, you're often on food. This is great. You're doing the celery juice, amazing. But I will add the amount of fruit intake that is consuming, specifically the antioxidant berries, so wild blueberries, blackberries, raspberries, cherries. I would also add more watermelons, melons of all sorts, because they're really good on flushing out toxins, and as well as grapes and citruses. They're very alkalizing. I would also add the cilantro, coconut and coconut oil, bananas, of course, flax seeds, if you like them. As far as the heavy metal detox smoothie, so now it's a heavy chelator, and I always suggest people to first make sure that they can filter properly the toxins, because the last thing you want is to go deep and bring to the surface heavy metals and toxins if your child is not able to detoxify properly. So whether because lymphatic system is stagnant or the kidneys are not properly filtering, you don't want the recirculation of the toxin. So I always advise to do the pee test, where you have him or her pee in a jar first thing in the morning, the first pee of the morning, and then you close it and save it for 24 hours in a dark place. The next day you go and check out the level of sediments that you should see at the bottom. If you see the pee completely clear, then he's probably or she's probably not filtering enough, and so I want you to hold on the heavy metal detox smoothie and maybe do more of a lymphatic cleanse type of situation, so that we make sure that the lymphatic system is properly filtering and the waste material is going out. But that is in case you don't see any sediment. If you do see sediments, please, by any means, go ahead with the heavy metal detox smoothie. And if he doesn't like the taste or she doesn't like the taste, possibly it's the cilantro. So you can still do the smoothie, just remove the cilantro or the barley grass if that's a problem, and try to sneak in the same day. The cilantro could also be taken in tincture or pills, the 5 ingredients. So the most important part is not to have all the ingredients all together at once, but all the ingredients within the same day, and that will still be very efficient. As far as supplements, Nicole, I see that you're very focused on the antiviral type of protocol. I will switch the focus to more of a anti-heavy metals type of protocol. So keep the B12, but I also in the spirulina, whether he takes it in a smoothie or not, spirulina is really important. The magnesium, yes, for his central nervous system, is going to calm him down and maybe level out a little bit some of those behaviors that you were referring to. But I will also add melatonin and ginkgo biloba. They're really great at supporting the adrenal and thyroid, and so the central nervous system, and the ginkgo biloba on removing specifically the mercury from the brain. Also add a good source of fat like ADA or DHA, specifically from a vegan source, as well as a good source of probiotics. As far as the meat, now going back to, the meat is not enough food, but meat is really heavy for the liver. And so if your child is not filtering properly, my advice would be to increase the amount of fruit intake and remove or reduce as much as possible the amount of animal protein, simply because the amount of fat is going to kind of burden the liver a little bit more. So just try, maybe do a test maybe for 3 to 4 weeks where you reduce the amount of animal protein, maybe do twice a week, and instead you increase the amount of fruit, specifically what I said before, the melons, the watermelons, the grapes, and the berries, and see if anything changes. The next question is about ocular rosacea. Let's see what they're asking. Hi Barbara, thank you for this opportunity. I'm currently doing celery juice and no foods for 1 month. 1 round of 369 completed. Heavy metal detox smoothie 2 weeks and currently still on. I've worked through acute anxiety and insomnia so far in this past 2 months. Yay. I'm trying to get through ocular rosacea. I'm not seeing any improvement whatsoever. I'm taking the following supplements from a natural doctor. Are these okay with the medical medium protocol? And the supplements will be the Super EFA, the Liquid B Complex, the DMF, Neuroprobiotics, the Biotone EFA, Vitamin D3, the Gamma-D Zinc Copper. So the ocular rosacea is another form of rosacea, and rosacea, as you guys know, it stems from mercury present in the liver and the liver inability to detoxify from it. So I would say that 2 months maybe are not enough to see substantial results, depending on how burdened your liver is, and a little bit of background about you that right now I don't know. So I'm just saying 2 months might not be enough. As far as the supplements you're currently taking, some of them are not in line with the medical medium guidelines. This is your question. Particularly, we are looking at the fish oil. Make sure that it's actually a vegan source. The UNDA has alcohol in it. The Biotone EFA contains soy, so alcohol and soy are better to be avoided. And then you're taking a form of zinc and copper together. Anthony stresses the importance of zinc deficiency, and for this reason they do balance each other out, but because we're so deficient in zinc, I think it's unnecessary for you to take also a form of copper together. So I would just focus on the liquid form of zinc that Anthony is recommending, and just give it a little bit more time. Our next question is from Zora Aslam. Let's see what she's asking. Hi Barbara, what are some of the detox symptoms that people experience while on the medical medium Epstein Barr protocol? Is it normal to have sinus and head pain and lightheadedness from the detox? Thanks, Zora. Zora, yes, it's absolutely normal, and you will see there are other common symptoms during the detoxification process. The reason being that I'm going to tell you about, but the reason being is because as we detoxify, we kill viral cells for once, and so in that moment our toxicity level raises, and those are the moments where we feel more of the type of detox symptoms. So if you were to create a graph, you will see that goes through ups and downs, up and down, but if you could chart it, it will still trending up. So meaning you will feel better overall, but you may go through moments where you're not feeling as good. And some of the symptoms could be mild aches and pains, some headaches, lightheadedness, vertigos, some mucus, some low-grade fever, some flu-like symptoms, some mucus discharge, because when the body is really toxic, we produce a lot of mucus. Some of the food we eat is mucus forming food, so it is not uncommon during the detoxification process to produce from really every hole in the body a lot of mucus. So these are very common symptoms, and as I said, they happen when our toxicity level at alternative times they go up. So nothing to be concerned. One thing I wanted to point out is the difference between a detox symptom, because I see on the group everybody asking for advice and everybody easily dispensing the advice, the well-intended advice that, oh, probably is a detox symptom. Now, not everything is a detox symptom, and one rule of thumb that you can use to kind of gauge whether you're experiencing a detox symptom or a healing crisis or a detox crisis is that usually the detox symptoms don't last too long. So they are short-lived and they change. You might experience the inflammation of an old type of disease, or type of symptoms and you didn't have it for a while, but even if they do come back, they're usually short. Skin issues or skin rashes are very common, cold sores, UTIs, but they usually are short-lived. So if you have an episode that lasts more than, I would say, a few days, then something needs to be addressed. The next question comes from Suki Lee, and it's a pretty interesting one because she's asking about a specific tool for her job. So let's see what she's asking. Dear Barbara, I'm a digital artist and I want to buy an Apple Pencil. I'm worried about the health effects of Bluetooth. Should I buy a non-Bluetooth pencil instead? So Suki, this is a very good question because people usually are so focused about the food that we forget where all else we get toxins and radiations and they're affecting our well-being. So Bluetooth, I'm not gonna lie, it is not healthy, and unfortunately there are some sources that we can't avoid. My advice is the ones that we can avoid, it's better to do so. So if you can avoid having a pencil that is a Bluetooth pencil, then I would say just go for the non-wireless one, because it's not just the pencil per se, is the frequency with which you're using the pen, and I'm assuming every day, so that is also adds up as a cumulative effect. And the other one is exactly that, the cumulative effect. Probably you're not just using the pencil, you're using the cell phone. I'm talking about the wireless and the Bluetooth watches, for instance, like the Apple Watch. I'm talking about the headsets, the wireless headsets. But I mean, I'm a mom, I've removed my baby's monitor because it's also Bluetooth. So we are really surrounded by Bluetooth technology, and sometimes we can't do without, but when we can, I would always advise against it. So if you can find a wired pen, for me, that would be preferable. Next question is from Erica Smith. Erica is asking, I've been using Gamson oil paint solvent for oil painting. My question is this toxic to my health? Also, are oil paints harmful to be around? Should I stop painting? Okay, so this is a very good question, Erica. And first and foremost, do not stop painting, because painting is such a good activity to do that actually I invite people to start picking up a hobby because it's so good for your health. When you are happy doing something that you love, in this case painting, you produce the good hormones, and we do need them, like endorphins, to counteract also the effect of the bad hormones like cortisol and adrenaline. So it's super good for your health. Continue to do that, but do it in a safe way. So Gamson oil, it's a medium used by artists to alter the characteristics and the appearance of the paint. Now, it is deemed safe on healthy skin. That means that if you have a wound or a cut, it is no longer safe. So to me, in my opinion, it's still toxic, but there are ways around it. So you could, for instance, use the paint straight from the tube and use like a knife technique. But if this is not an option, then you can choose to dilute it, to use a different medium like essential oils. They actually used to do it in the 1400 before all this new chemical stuff was created. So use lavender oil, so you also have some kind of a sensorial experience, or walnut oil, as well as linseed oil, which is flaxseed oil. If you happen to be in a studio and around other people that may use toxic or heavy solvents, then I will say use a mask. The next question is about the Rife machine. Let's see what John asks. Dear Barbara, is Rife an effective treatment method? I keep hearing success stories, but I worry about producing adrenaline, making people feel like they're getting better rather than treating the root cause. Should I do it? So John, this question has been asked before, and my opinion to this is that every time we alter the chemistry of the body, there's going to be consequences. Now, the results of the Rife machine have not been studied enough, and these consequences may not be clear yet. So I'm not sure, because you didn't mention this in your email, if you're doing it for cancer treatment or for just viral loads and bacteria. If you're doing it for the cancer treatment, again, it is not being proven safe. If you do it for viral issues and bacteria, then I will say please do use the food, because this has been proven over and over again to be effective. And again, every time we alter the chemistry, then we don't know what we're dealing with. So I would say for viral activities and bacterial activities, then stick with the food and some supplements, and you know for sure that you're gonna get better. So this is it for today. Thank you guys so much for following me and for sending in the questions. If I didn't get to your question today, please tune in 2 Thursday from today. And make sure to subscribe to my YouTube channel below and hit the bell so that you will be notified when the next video will be uploaded. See you soon.